In April 2023, the 4 regional health authorities and the Newfoundland and Labrador Centre for Health Information began the transition to one provincial health authority, Newfoundland and Labrador Health Services. This change, as outlined in Health Accord NL, is leading to a more cohesive and integrated healthcare system as we deliver health services to Newfoundlanders and Labradorians. NL Health Services is responsible for delivering health services to more than 540,000 Newfoundlanders and Labradorians across the province, within a $3.1 billion budget. With over 22,000 employees, 1,100 physicians, and 1,800 volunteers, we operate in 5 geographic zones. We work collaboratively with residents, communities, and partners to achieve our vision of health and well-being. Every person, every community. Our mission statement outlines how we intend to get there, which is by working together to improve health outcomes through an innovative, integrated, and sustainable health system. Our values enhance our people and family-centered care philosophy, where the people we serve and their families are at the heart of every decision we make and every action we take. There is much work to transition to a new provincial health authority. Our first year, we established the following strategic priorities. We are proud of the performance we achieved in each of these areas during year 1 of the transition, and we will continue to build upon these successes. Transformation. To achieve meaningful transformation, we began establishing innovative structures to advance the integration of strategic health networks. Of particular note, we began to modernize our healthcare system so that it is integrated, more sustainable, well-balanced, and better meets the needs of the people of Newfoundland and Labrador. We also began implementation of a new health information system, marking the beginning of the largest digital health system transformation ever undertaken in Newfoundland and Labrador. Our people. Newfoundland and Labrador, like the rest of the world, has experienced a global shortage of healthcare workers. To help address this, in our first year, NL Health Services launched a recruitment and retention strategy and partnered with the provincial government on the Work in Health NL campaign to provide opportunities and incentives to attract and keep healthcare workers in all healthcare fields across Newfoundland and Labrador. This includes international recruitment efforts with missions started in various countries. Thanks to our successful retention and recruitment efforts, paired with the expansion of virtual care, the average number of emergency department closures and diversions in Category B sites was 1,081 hours, a reduction from 1,684 hours. We are continuing this work to achieve further reductions. NL Health Services has successfully recruited more than 300 internationally educated nurses to Newfoundland and Labrador since 2023 and over 160 physicians. Work is continuing to recruit physicians, nurses, and other healthcare professionals. Access. To improve access to services, NL Health Services must also be innovative in our approach to provide the most appropriate level of care and services, address areas that are experiencing high demands, and empower individuals and families with the skills and ability to understand and navigate the healthcare system. Family care teams innovatively support our work to reimagine and redesign the health system in Newfoundland and Labrador. During 2023-24, the number of individuals connected to a family care team increased from 28,895 in April 2023 to 55,455 as of March 2024. The number of family care teams established doubled from 8 to 16 and exist in all areas of the province. NL Health Services increased the volume of hip and knee replacements and cataract surgeries performed in our healthcare facilities. Last year, we also implemented technologies to support booking, canceling, and rescheduling appointments. By integrating supportive services, streamlining workflows, and increasing accessibility associated with the current booking systems, we will ensure that available capacity is utilized appropriately. Quality. In 2023-24, We also began work to standardize and improve how we can promote meaningful engagement with patients, families, and communities. We are doing this work through patient and family experience advisors and community advisory committees. We believe that the people who use the health services are our equal partners. This means putting people and their families at the center of decisions, working alongside professionals to get the best outcome. Engaging clients and families as equal partners in care improves client experience and is linked to improved individual and population health outcomes. NL Health Services recognizes the value of enhancing partnerships with Indigenous communities. In 2023-24, we moved forward on our commitment to developing a culturally competent workforce, delivering culturally safe care, and addressing social determinants of health in collaboration with Indigenous peoples. As we move forward, there will be an increased focus on health equity, improved access to mental health and addiction services, and many other areas of healthcare. Thank you to everyone for your support during our first year as a provincial health authority.